What's up, everybody? This is Adam Richmond, athletic trainer and owner of Precision Performance Therapy, back here again with Jared Perrette. This time we're going to go over the supine hip dissociation with active knee flexion and extension. So I'm going to have Jared lay back on the bench. We're going to bring both knees up towards the chest to kind of help flatten out the low back. So the first thing I'm going to do whenever he sets up, I'm going to have him take a nice deep breath in through his nose, have him do a nice active long exhale to get the rib cage to come down and the pelvis to come up, and we're going to make sure his back is flat on the bench. So we want to make sure he can feel the contact of the bench under his low back, and we need to maintain that abdominal contraction and the contact with the low bench throughout the exercise. So we're going to target his left hip extension. So we're going to have him lower his left leg down towards the RX pad. So we want his foot to be flat on that RX pad. As you can see, he has a little bit of tension there that he has to work through. So he actively has to use his hamstring and glute to push into the blue RX pad. Actively contracting those muscles will reciprocally inhibit the quadriceps and the hip flexors, allowing you to go into hip extension. Again, while you do that, you need to be actively contracting the abs and having contact with the low back on the bench, so that way we're not compensating through the lumbar spine and getting hip extension through the low back rather than through the actual hip. We're going to add some breathing to this to try to lock everything in. As he extends the knee, I'm going to have him breathe in, and then as he exhales, we're going to have him flex the knee. Go ahead and exhale and flex, and then flex the knee down. Flex this knee down. Good. And then we'll have him inhale and extend, and exhale and flex. As he's doing that, do a couple more reps for me, Jared. We'll have him do about 4 or 5 breaths like that. As he's doing that, he needs to, again, make sure he has abs contracted, low back's contacted with the bench, opposite left hip is extending through the RX pad, actively contracting the hamstrings and glutes.